Hi there, welcome back to Amaize Health as we continue the journey to amazing health. I'm Dr. Thorpe Amaize, and this week we're talking or continuing the conversation on medication compliance, or as I said, taking the medicines the way it's prescribed, the dose that's prescribed, the frequency in which it was prescribed, and for the duration in which it was prescribed. So, we're continuing the AMA or the American Medical Association list of 8 reasons why patients are non compliant. Last week we went over fear and cost. This week we're going to go through misunderstanding, too many medications, and lack of symptoms. So, as far as misunderstanding, sometimes people don't understand why they need the medicine. That's simply a discussion. Sometimes they don't understand the nature of side effects, which basically means they just don't get the side effects. And that goes back to the fear that we talked about last week. And then also, sometimes it takes time to see the results, and people are impatient and don't want to wait, or they just don't understand that, taking a medicine today doesn't mean that your symptoms are going to be gone tomorrow. So for each of those, again, a discussion or a conversation with your healthcare provider would be important to have. So one example of the time that it takes to see results is when you take depression or anxiety medicines. Sometimes with those medicines, what happens is you have to give it a few weeks for it to really start working. So if you're someone that has depression or anxiety and you're like, I want to take something today so that my symptoms are gone today or tomorrow, that's not really a realistic expectation. And so having that conversation with your doctor to know about how long it'll take for you to start seeing some results, that should really help. Now, the side effect profile is something that should be discussed so you're aware of the possible side effects that can happen, so that if any of them happen that's inhibiting your quality of life, that you could change that medicine. But the need for the medicine, I think, is a key one, in that if you have high blood pressure and diet and exercise is not sufficiently bringing your blood pressure down, and you need to be on a medication for that, then, not waiting until you feel like your blood pressure is high to take the medicine is really critical. You need to take it to keep your blood pressure at a controlled level and to maintain it at that level. So the next one is taking too many meds. So a lot of our older patients have this as an issue because, as you get older in life, sometimes there are medical problems that start to add up. And every time there's another one, you feel like, oh, there's another medicine I have to take for that. But some of the medicines do double duty. And what I mean by that is you can use one medicine to treat more than one condition. Sometimes that does happen. And or the side effect of a medicine will treat another condition. So a lot of times we as clinicians or physicians, we like those medicines because then instead of giving you 2 medicines, we're only giving 1. But if you are on several different medicines and you're like, I just don't want to take another medicine. Doc, I'm tired. I don't want another one. Have that conversation with your doctor, or talk to them about the possibility of decreasing the medicines, or instead of taking a medicine that is prescribed for you to take 3 times a day, is there an option where you could take it once a day? So those are all appropriate conversations to have with your doctor. And then for the lack of symptoms, so sometimes when people take their medicines, like for instance, let's say you come in and you have an infection, and I'm treating the infection with an antibiotic, and the antibiotic is prescribed for a 10-day course. And I say, hey, sir, ma'am, you need to take the entire 10 days. But after day 5, you're like, I don't feel like I have an infection anymore. I feel better. I want to stop the medicine. Well, I would encourage you not to stop. Continue it to take the full 10-day course as it was prescribed, because we prescribe it for the length of time that we do for a reason. So sometimes when you stop the medicine before the appropriate time, that infection isn't fully gone. And now, instead of it going away completely, it starts to resurface because you stopped taking the medicine. The other thing is that it actually helps to breed antibiotic resistance, which is a whole nother conversation. But you're doing the best thing for yourself when you take the medication as prescribed. So some people feel like, okay, if I don't feel any different when I take the medicine. Like, if you're someone that have high blood pressure and you're like, I don't feel any different. Why should I keep taking this? Or you feel like you may stop your medicine because, okay, my blood pressure is now controlled. No, you want to keep doing that, because stopping the medicine would mean that now your blood pressure might actually elevate again. So the key really is, and the takeaway points for today is, discuss any concerns that you're having about your medications with the person that's prescribing them. Again, I said this one last week, but it's critical, so I think I'm going to be repeating it every week. If you feel you are on too many medications, talk to your doctor. Determine if decreasing the frequency, the dose, or the number of prescriptions is possible while maintaining your health. And then the lack of symptoms does not mean you should stop your medicine. It may simply mean that the medicines are doing what they're supposed to do to prevent you from having symptoms. So make sure you keep taking those medicines. So come back again next week as we discuss more of the reasons why patients don't take their medicines as prescribed and what we can do to change that, so we can continue that conversation on our journey to amazing health. To book me for a speaking engagement, or simply just to follow me on social media platforms such as Twitter, Facebook, LinkedIn, Instagram, or TikTok, it's at Amaize Health, or the website www.amaizehealth.com. Be sure to like and subscribe as you listen. And again, this is Dr. Thorpe Amaize with Amaize Health. See you next time.